A recent outbreak killed 35 people in Ghana in the last 2 months through a mosquito from the Aedes family. The yellow fever virus is found in tropical and subtropical areas of Africa and South America. The yellow in the name refers to the jaundice that affects the patient. There's no medicine to treat or to cure the infection. With dozens more suspected infection, the government is trying to secure 400,000 dosage of vaccines from World Health Organization.
When a person comes down with yellow fever, most people will have no symptoms at all. The initial symptoms we can see with those with yellow fever are headache, fever, body aches, nausea, vomiting, fatigue, and weakness. These symptoms normally improve within 1 week, but some people will still have weakness and fatigue for several months. 1 out of 7 people who contract yellow fever and experience initial symptoms will have a brief remission of about a day, followed by a more severe form of the disease. The severe symptoms include high fever, yellow skin, bleeding from the mouth, nose, eyes, or stomach, shock, and organ failure. Out of those who develop the severe disease, about 30 to 60% will usually die within 7 to 10 days. Treatment for those affected by yellow fever includes rest, drinking fluids, and using pain relievers to help reduce fever and relieve body aches. Things like aspirin and non-steroidal anti-inflammatory drugs should be avoided because they may increase the risk of bleeding. Those who are experiencing severe symptoms should be properly treated at a hospital.
Maybe wondering now if yellow fever may affect you and where the cases are most prevalent. 27 countries in Africa and 13 countries in Central and South America are classified as the most at-risk populations for yellow fever reported by WHO. Yellow fever has 3 transmission cycles, making 3 groups of people the most at risk for yellow fever. The jungle cycle is transmitted by mosquitoes from monkeys to humans visiting or working in the jungle. The savanna cycle is transmitted by mosquitoes to humans living, working in close proximity to jungle borders. The urban cycle is transmitted by urban mosquitoes to humans, and the virus is usually brought to an urban setting by a person who is infected in the jungle or savanna. If traveling to these countries, remember to get the yellow fever vaccine before going, as the vaccine provides lifelong protection for most people.
Some ways that you can prevent yellow fever is by avoiding mosquito bites, and some ways that you can avoid mosquito bites is by using bug repellent or mosquito repellent. You can also cover up by using long sleeves and pants rather than shorts or exposing your skin. At home, you can avoid mosquitoes by using screens on your windows and doors. And when traveling, like out of the country or out of town, just make sure that the hotel you're staying at as well has like screens and screens on their doors and screens on their windows. And if you have a pool in your backyard or if you have like puddles, just monitor the water weekly so that way mosquitoes don't lay eggs in the waters.